I'm Dr. Pillay, and I'll be your guide on this journey to explore the latest in diagnosing, treating, and screening for mild cognitive impairment and mild Alzheimer's disease. Before we begin, would you like a quick overview of the XR controls? These controls will assist you in navigating and participating in the activities.
Hello. I'm your program narrator, here to provide guidance and share additional insights as we go through both activities.
Okay, let's get started. We've got 2 patients today. Our first patient is accompanied by her caregiver, who's noticed some concerning changes in her memory. We'll start with an initial assessment to check for mild cognitive impairment. The second patient, along with her husband, is here for a follow-up session to discuss the possibility of an Alzheimer's disease diagnosis. Now, which patient pathway would you like to start with? Thank you for your choice. Let's focus on Mary, our first patient. Mary is an 86-year-old woman who's been experiencing memory issues. After conducting an MRI and biomarker assessment, we found evidence pointing to a diagnosis of mild Alzheimer's disease. May I please ask you to answer a question before we begin? Let's get started once you have answered. Here is a second question.
We learned from the test results that our patient has a provisional diagnosis of mild Alzheimer's disease based on positivity for amyloid beta and markers of neuronal injury.
Let's examine some of the structural changes that we might expect to see in a patient with early onset Alzheimer's disease.
In the area indicated by the arrow, we see the medial temporal lobe. Greater degeneration in this area suggests progression.
Hi there. It's great to see you once again. I hope you're doing well.
Hello doctor, thank you for meeting me today. I am here to discuss Melanie's risk for dementia.
It's a pleasure to meet you. I appreciate your proactive approach in discussing Melanie's situation. Let's delve into this and see how we can address her risk for dementia. Let's begin by asking a few basic questions. I'll help you along the way.
Okay.
Does Melanie have any underlying medical conditions, such as high blood pressure, diabetes, or high cholesterol?
Yes. Melanie has high blood pressure.
It's crucial to carefully manage Melanie's high blood pressure since it increases the risk of developing dementia. Is Melanie following a healthy diet?
Melanie adheres to the DASH diet by incorporating fruits, vegetables, and whole grains into her meals.
Is Melanie engaged in any cognitive training exercises?
Melanie doesn't engage in any cognitive training exercises.
I suggest that Melanie incorporates cognitive training exercises into Melanie's routine can indeed be beneficial in enhancing her memory, attention, and overall cognitive abilities. Doctors employ various cognitive assessment tools and diagnostic tests to evaluate patients for cognitive impairment and neurodegenerative conditions like Alzheimer's disease. One such assessment is the Mini-Cog, a concise and validated test frequently used in healthcare settings to swiftly screen patients for signs of cognitive changes. Another comprehensive assessment is the Montreal Cognitive Assessment, MoCA, which evaluates multiple cognitive domains, including attention, visuospatial abilities, and executive function. A common element in many of these tests is the clock drawing test, assessing visuospatial and executive function by requesting the patient to draw a clock displaying a specific time. Let's try drawing a clock inside the circle ourselves. Could you please draw a clock inside the circle? Please set hands at 10 past 11. Let's move on to scoring. The process is straightforward. You'll receive 1 point for every word you recall correctly and 2 points for every accurately drawn clock. If your total score is 0, 1, or 2, there's a higher chance of having clinically significant cognitive impairment.